Good afternoon. It's Wednesday, September 2nd, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Andrew Furey, the Honourable Tom Osborne, Minister of Education, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's weekly COVID-19 briefing for today, Wednesday, September the 2nd. First of all, let me assure you Dr. Haggie is doing fine and recovering, and we hope to have him back very soon. He's anxious to get back to work, and I'm anxious to have him back to work. To all the dedicated teachers, administrators, and staff, welcome back. Albeit different than usual because of the realities of the new normal that is life with COVID-19. You are on the front lines of essential work for your fellow Newfoundlanders and Labradorians, and most importantly, for our children and teenagers. Thank you. Please know that your commitment to your vocation is recognized and appreciated by all of us. And that goes for all the frontline workers in this province, from nurses to truck drivers and many more who have made untold sacrifices. I know many of you are facing anxieties and stresses in the jobs you do, and taking time away from your families to do so, including rotational workers, traveling long hours to do essential work and coming home to isolation. We hear you. We are listening to your concerns and to those of your families. You continue to make tremendous sacrifices to help slow the spread of COVID-19 in our communities across our country. So we are working on solutions for the many of you traveling within Canada to work, to find a way to make your lives a little bit easier while ensuring the health and safety of Newfoundlanders and Labradorians. And I want to stress that point. The health and safety measures in place across the board are based on medical evidence, based on public health guidance from Chief Medical Officer Dr. Janice Fitzgerald and her team. Folks who are working hard, consulting with partners across the country to stay up on the recent evidence of COVID-19. The measures are designed to protect us all from the spread of this virus, and all the plans in place, particularly the safe return to school, are dynamic. They are not restrictive, rather, they are responsive. We have seen this in action over the months of the pandemic. Look at where things started just a few months ago at alert level 5. Now, thanks to everyone's hard work and respect for public health guidelines, we have many more freedoms to move around our communities safely. Grandmothers and grandfathers can hug their grandchildren. That first moment when grandchildren and grandparents could reunite was so special in our home, as I'm sure it was for many of you. Now, thanks to everyone's hard work and respect for public health guidelines, students across Newfoundland and Labrador can get back to school, to see their teachers, and to see their friends, and to learn in a secure, healthy environment with an arsenal of measures in place to keep schools and communities safe from COVID-19. Now, I understand students, teachers, administrators, and staff are nervous. Recent changes to the education plan acknowledge your anxieties. Again, we are listening. I'd like to ask the students of Newfoundland and Labrador to listen to me and to Dr. Fitzgerald for just a moment. We are taking every measure possible to make sure you are safe in school. I know it's scary. I know it's strange. And I know it's weird. You've been out of school for a long time. But it's going to be okay. My wife Allison and I understand. Our 3 children are in the same boat. Like you, they are excited about going back to school, but are also a little nervous. And I want to tell you what I tell them. Talk about it. You are not alone. Talk to your friends. Talk to your parents. Talk to your teachers. And if that's not enough, please reach out. There is help for your stress and anxiety. We are all in this together. Families, educators, staff, everyone in our great province and across Canada, and in fact, around the world. So let's keep working together. Thank you all very much, and I'll turn it over to Dr. Fitzgerald for her update.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have no new cases in the province, and the total number remains at 269. 265 people have now recovered, and in total we have tested 32,447 people. We've gotten to where we are today because our communities came together and supported one another. We know that when we work together, we do better. This pandemic has upended everyone's lives, and perhaps no group more so than our kids. Back to school is an exciting time, but COVID-19 has understandably heightened everyone's awareness and nervousness. So remember that if you need to talk to somebody, please reach out. There are resources available to support you and your family. Please visit bridgethegap.ca for more information. Our learnings from this pandemic and our low prevalence of cases has positioned us well to begin reopening our schools. This school year brings with it new challenges as we learn to live with COVID-19, but it also brings with it familiarities that will help support our children and youth. Returning to school is a balance of weighing the harms of the virus and the benefits of our kids to learn with their peers and have the support of the whole school community. We know that we may have cases, and protocols are in place to swiftly respond. One word you may have heard me use recently is cohort, and it is being used across the country at the moment by other chief medical officers of health and public health officials. A cohort is a group of students and staff who remain together in close proximity throughout the school year and are separated from other such groups. Simply put, this year a cohort is your child's classroom, and it includes the teacher, your child, and their classmates. The benefit of having cohorts in our schools is that they help to reduce the number of in-person close interactions a child may have while in school, and therefore allowing us to help reduce the spread of COVID-19. It is important that everyone remember, as we get ready to go back to school, if you're not feeling well, stay home and avoid contact with others. Parents and guardians must watch for symptoms of COVID-19 or the common cold or flu in your children. And if your child does have symptoms, please keep them home and call 811 for appropriate follow-up and advice. You can also complete the online self-assessment tool available on the COVID-19 website. If your child is not feeling well or experiencing symptoms of COVID-19 in school, they will be isolated immediately, away from the other students. School staff will contact the parent or guardian and ask them to come pick up their child as soon as possible. And once you arrive home, you should call 811 for appropriate follow-up and advice. And testing for COVID-19 will be arranged for your child if it is deemed to be necessary. A child with a confirmed case of COVID-19 must stay home in self-isolation as advised by public health officials. In general, this is 10 days after the onset of symptoms, provided symptoms are resolved. Public health will monitor your child and give the all clear to the parent or guardian when the child can return to the classroom. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number in the province remains at 269. We'll continue to look at the epidemiology and work with the best available evidence at the time to base our decisions. As the evidence changes, we will be responsive and ensure we change with it. We will continue to tackle these challenges together as we work towards our common goal of ensuring the health, safety, and well-being of the school community and of our province. Thank you.
Well, thank you, Dr. Fitzgerald, for that update, and I'm now going to turn to Minister Osborne to give us an update on the school situation.
Thank you, Premier. I would also like to welcome administrators, teachers, staff back to school, and thank the Premier for his input and guidance as we resolved the many issues and continue to work on others. The early return to school this year is providing additional time for teachers, principals, and staff to receive orientation on health and safety related procedures and to prepare schools for the arrival of students on September 9th. I know that some have already been busy planning and communicating with families about the upcoming school year. Custodians have been in schools for some time preparing for the reopening. It is a very busy time across the education system, and I want to acknowledge the work of our principals, teachers, custodians, school secretaries, and all of those who've been involved in getting our schools up and running for the start of school. Your work is important and it is appreciated. A new school year always brings excitement and anticipation. Teachers are reconnecting with colleagues and students. Students are excited about moving to a new grade, seeing old friends and teachers. Each year, there can be some level of anxiety about the same things. It is important to ensure, as parents and as educators, that we help ease and reduce those anxieties, and when necessary, help students deal with them. This year, we have provided additional professional learning to our educators focused on social and emotional well-being and trauma-informed practice. And of course, this year, because of COVID-19, school will look a little different. The Federation of School Councils is hearing regularly from parents about the year ahead. They are anxious about the uncertainty with the pandemic, but they want their children back in school. They are worried about the amount of instructional time that was missed last year when school was closed. Students are saying they need to be back in school. The Federation of School Councils have trust in the guidelines of the Chief Medical Officer of Health, the department, and the school districts. We continue to work with all of our partners in education to have a safe and smooth return to school. I want to thank the Premier for his input and guidance as we've resolved many of the issues. We have announced several measures in the past 2 weeks to enhance the support and return to school plan. We are hiring 70 substitute teachers on term contracts for specific schools, increasing custodian hours from 5 to 7 hours per day, hiring 25 additional custodians, adding 15 administrators, adding 25 guidance counselors, providing cleaning supplies to busing contractors, providing masks to students, teachers, and staff, ensuring a robust supply of disinfection materials, and putting safeguards in place in high-traffic areas. We have also purchased 5,100 laptops for every teacher in the K-12 system and 30,000 Chromebooks for every junior high and high school student across the province. Tomorrow, we will be providing further information on several initiatives. Myself and the Premier have been consulting with the NLTA, with NAEP and CUPE, the Federation of School Councils, and other stakeholders. We've spent much time listening to suggestions and concerns, and we are finalizing the details on a resolution to school busing, on additional supports for students and families, on additional student assistant resources, public health, and occupational health and safety resources. Our primary focus is twofold: ensuring that our students receive the education they need, while ensuring everyone in the school setting is able to return to school safely. We remain focused on listening and working collaboratively. Thank you.
Thank you, Minister. I'll now open it to questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 3 reporters registered for today's call. Each reporter will have the opportunity to ask 1 question and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. We've seen the NLTA, they've insisted that smaller class sizes are needed for physical distancing. We've heard from Dr. Fitzgerald and the Minister that they're not needed. But can you give us an idea, how doable would it be to reduce class sizes in terms of the physical space required and the number of teachers that would be required if you did decide to do that?
That, Peter, requires a great deal of analysis. I saw a quote actually from the Alberta Premier who said that every cent of federal funding would be required to do the same in Alberta. It is complex. It's an important issue, I understand, for the NLTA and their educators, but it's a complex issue. There are many things that have to be considered when looking at that issue. And it's something that obviously won't be resolved between now and September 9th. It's something that would require a great deal of time and focus.
And a question about rotational workers. We heard the Premier briefly address that up front. Dr. Fitzgerald, you said a week ago that in the coming days there would be changes coming in order to try and address some of their concerns. I've been hearing from lots of workers who are saying, why don't we just address the same measures New Brunswick has, which is no longer require isolation, considering it's worked well there. They're dealing with the same evidence and information and epidemiology that we are here.
Yeah, so we have been looking at this question, no doubt, and we certainly have looked at what places are doing elsewhere in the country, and I hope that by the end of the week we'll have an answer.
Thank you.
Our next questions are from Jody Cook of NTV News. Please go ahead.
I'd like to begin with a question with relation to, on the weekend, we had what we expect could have been a false positive. Still 20 healthcare workers were put into self-isolation. Is there an update on that?
Yes. So the case in question is not so much a false positive as it's a residual RNA in the sample. So it's someone who is not infectious at this time, as we've explained previously. So we don't believe that they're infectious, and so we have advised that the workers don't have to self-isolate.
Okay, so they're out of self-isolation then, for clarity?
Yes, so I just actually was chatting with occupational health about that, so I'm not sure if they're quite out of isolation at this point, but that's been the advice.
Thanks. Health Canada approved a list of home testing kits this week, which is sort of a big step for Health Canada to do this, and the expectation is this will alleviate some concerns for parents in this province considering maybe implementing this or allowing this for the potential coming year.
I'm sorry, I missed part of the question there, Jody. Sorry.
Okay, thanks. Health Canada today announced that they have approved a list of home testing kits to be used. So can you see that actually working here in Newfoundland and Labrador? And I know specifically this was focused from Health Canada's perspective on support for parents to be able to test their kids in school setting situations.
Right. So certainly we'll have to look into that a little more in depth to be able to provide any kind of advice or direction on the use of those tests.
I appreciate also that this has been a question that you are consistently asked about, but yet
Jody,
remiss
you have
not
one
to.
question. Jody, you have one question and one follow-up. You've had your opportunity, so
Oh,
if we have
thank
a little
you,
bit more
thank you.
time, we'll ask for your question. Our next questions are from Brian Medore of VOCM News. Please go ahead.
Thanks. And I'm just wondering about the convalescence, if you will. Normally, child who's sick, they go to the office. I know you announced that there would be a separate room, and we're just wondering, have you worked out details regarding how that room would look, what would be in it, what should be in it, who would go there? Would you have two children who are sick go there at the same time? How is that all going to take shape?
So I think that's something that has to be operationalized at the level of the school, and certainly, the schools are aware of what the requirements would be. So the children would have to be able to be separated from the other children, and then they would have to be separated from any other children that were sick by at least 6 feet. So, but the actual operational details of how that would work in every school is obviously going to have to be looked at by the administrations in those schools.
New Brunswick just announced some details of their music program in schools. They are going to be allowed to have music. Some differences, of course. Sing softly, I think, is what we're seeing. Where do we stand in terms of that issue of music in our schools?
So there are music classes, to the best of my knowledge, still happening in schools. If we're talking about singing and wind instruments, that is something that we're actively looking at right now, and hope to have some direction on that very soon.
Thanks.
So we still have some time left, so we're going to start with Peter Cowan from CBC News. You have 1 more question. Please go ahead.
Thank you. We've heard from rotational workers, they're concerned that their children might not be welcome in classroom because they've been having to isolate. We've heard from teachers who've expressed concerns that children who are living with someone who's isolating may be a way that COVID is introduced into the classroom. I guess, Minister Osborne, if you could comment on what the policies are, and Dr. Fitzgerald, can you give us a sense of how big of a risk that might be for spread of the virus?
Probably best dealt with by Dr. Fitzgerald first, I would think.
Yeah, so the risk right now, I mean, certainly we know with many of these camps that, or these workplaces that rotational workers come from, that there are lots of safeguards in place in those workplaces to prevent the spread of COVID-19. And, you know, a lot of these workers are actually being tested as well at these workplaces. So, and given that the epidemiology right now across the country is stable, certainly the risk is, well, I mean, there is no zero risk situation. The risk for those families, if we have an asymptomatic worker, is low. And certainly while that worker is asymptomatic, our advice is that those children would be allowed to go to school, and we hope that the school community will welcome them and you know, that they'll be treated with the respect that they deserve.
I think in response, the biggest fear, I think, is not seeing the school setups, the classrooms, how teachers, educators, administrators are going to deal with situations. Each school building is unique. The populations of the school or the number of students is unique. But I have confidence in our administrators and the protocols put in place by the English School District. I've been given every assurance that, and as Dr. Fitzgerald has said, the risks are very low. The largest concern is dealing now with the unknown. I think once students are back in school and things start to proceed as a regular school year, some of those concerns won't be to the same height that they are today.
Thank you.
Next, we'll hear from Jody Cook of NTV News. Please go ahead.
Thanks, Kathy. Sorry, this was the question I was going to ask, and I understand that you get it asked every week, but without further ado, here we go. Is there any expectation of a further consideration to open up to a Canadian bubble, with Atlantic Canada being the only jurisdiction that continues to work within these parameters?
So at the moment, you know, we're busy with school, and so those conversations have not really happened much as of late. So I think we're going to wait and see what happens with school, and then I guess that'll be a bigger conversation for later.
Thank you.
And our final question today is from Brian Medore of VOCM News. Please go ahead.
Question for the Premier and the Minister. Normally, first week of school, you guys would visit a school. What are the plans for next week? Do you plan on visiting a school next week?
Well, I can speak. I plan to take my children to school next week.
Outside of that,
Yeah,
yeah.
I know, right, you're again. No, I mean, we'll follow the public health guidelines, and I would suggest that and I would look to Dr. Fitzgerald, but presumably where we would, outside traffic, if we can minimize it to the best of our abilities, we should. And I'm considered outside traffic, so I would not be going into any school environment unless approved by under the current guidelines and given the green light that way.
I would concur. I think ideally it would probably be an education in and of itself to take a ride on one of the school buses. But that would mean that somebody would not get a ride on the school bus, or similarly, the goal is to reduce to the greatest extent possible visitors within the school system, and I will honor and respect that goal.
Thanks.
Premier, did you have any final remarks?
Well, thank you all for joining us today. I'd like to echo what Dr. Fitzgerald said in her opening remarks, and that's, if you are feeling unwell, please stay at home. Please call 811 and remind people what we reminded them last week, and that's, of course, flu season is coming up, so please get your flu vaccine. Thank you very much.
Thank you very much for attending today, folks. Please join us again next Wednesday, September 9th at 2 p.m., 1:30 in most of Labrador. Have a great evening.